Imagine a world where your doctor, with a perfectly straight face, prescribes a spoonful of radium for your persistent cough, or perhaps a few electric shocks to cure your hysteria. This wasn't some dark fantasy novel plot. These were real, widely accepted, and often horrifying medical procedures in the seemingly civilized Victorian era. But how could an age of groundbreaking discovery also be an age of such bizarre and often brutal treatments? To truly grasp the bizarre landscape of Victorian medicine, we need to strip away our modern understanding of germ theory, antibiotics, and ethical clinical trials. The 19th century was a paradox, a period of incredible intellectual ferment, a time when monumental scientific leaps were being made daily, yet still deeply rooted in ancient superstitions and a profound ignorance of human biology. Louis Pasteur was only just beginning his work on microorganisms, while across the Atlantic, doctors were still bleeding patients to balance their humors. The medical profession as we know it today was barely coalescing. Anyone could set up shop as a doctor, often with little to no formal training, leading to a bustling marketplace of remedies ranging from genuinely effective new drugs like morphine to outright snake oil and literal poisons. Disease was rampant, life expectancy was short, and desperation fueled a willingness to try almost anything. This created a fertile ground for practices that, to our modern eyes, seem like something torn from a horror story. The lack of regulation, combined with a rudimentary understanding of physiology and pharmacology, meant that a patient's suffering could easily be exacerbated, not alleviated, by the very hands meant to heal them. But things quickly escalated beyond mere incompetence. As the century progressed, the desire for quick fixes and impressive cures led to an embrace of substances we now recognize as deadly. Take, for instance, mercury, a heavy metal known today for its extreme toxicity. In the Victorian era, it was a common treatment for everything from syphilis to digestive issues, often administered in large, debilitating doses. Patients would suffer from mercury poisoning, experiencing tremors, memory loss, and organ failure, all while their doctor believed the mercury was purging the illness. Then there was arsenic, famously used as a poison but also hailed as a cure for malaria and asthma. Advertisements for Fowler's solution, essentially a concoction of arsenic, promised miraculous recoveries, conveniently omitting the grim side effects that often included skin lesions, nerve damage, and death. Opium and its derivative, morphine, were widely available and recommended for everything from teething babies to chronic pain in adults, leading to widespread addiction that was often misdiagnosed and stigmatized. Cocaine, initially lauded as a miracle drug by none other than Sigmund Freud, was marketed in tonics and elixirs for fatigue, depression, and even toothache, creating a generation of unwitting addicts. And let's not forget the terrifying fad for hydrotherapy, which often involved wrapping patients in cold, wet sheets for hours or subjecting them to incredibly powerful jets of water, supposedly to shock the illness out of them. The line between therapy and torture was becoming increasingly blurred, driven by an almost pathological belief in the power of dramatic intervention, even when the underlying mechanisms remained a complete mystery to those administering the cure. The patient, desperate for relief, would often endure these procedures, believing implicitly in the doctor's authority, even as their condition worsened. What they discovered next, or rather what they subjected patients to next, changed everything in the most horrific way. The darker side of Victorian medicine wasn't just about ingesting toxins, it often involved extreme interventions with irreversible consequences. Consider the plight of women in this era. Any unexplained distress, emotional upheaval, or even a strong opinion could be labeled female hysteria, a catch-all diagnosis that could lead to forced institutionalization, often in incredibly harsh asylums. Once inside, treatments ranged from prolonged bed rest with minimal sensory stimulation, which we now know worsens mental health, to forced gynecological surgeries like ovariotomies, the removal of healthy ovaries, all in a misguided attempt to cure their supposed emotional instability. For physical ailments, surgery was a brutal affair. Before antiseptic techniques became widespread through the work of Joseph Lister, Operations were gruesome, bloody spectacles with terrifyingly high infection rates. Imagine a surgeon operating with unwashed hands, unsterilized instruments, and often without any effective anesthesia beyond a swig of brandy or crude opium. The screams of patients were commonplace, and death on the operating table was a tragically frequent outcome. Beyond the sterile confines of a hospital, entrepreneurial charlatans capitalized on public fear and ignorance, peddling electric belts that promised to cure everything from impotence to arthritis with mild shocks, or radium waters and radioactive suppositories that were guaranteed to boost vitality, ironically causing immense long-term radiation damage. People would ingest or apply highly radioactive materials, believing it was a wondrous new scientific breakthrough, only to suffer agonizingly slow and painful deaths from cancer. The pursuit of health became a gamble with often fatal stakes, a testament to an era where scientific curiosity often outpaced ethical considerations and basic understanding, transforming once revered healers into unwitting agents of suffering and death. To this day, we may never fully comprehend the extent of the suffering endured under these misguided practices. The Victorian era stands as a stark, chilling reminder that scientific progress alone does not guarantee ethical or effective medicine. It was a time of immense intellectual awakening, yes, but also a period scarred by ignorance, prejudice, and a dangerous willingness to experiment on the vulnerable. While we have thankfully moved light years beyond mercury pills and radium tonics, the legacy of Victorian medicine serves as a critical cautionary tale. It underscores the vital importance of rigorous scientific methodology, ethical oversight, and a deep empathetic understanding of the human body and mind. The slow, painstaking journey from superstition to evidence-based practice reminds us never to take for granted the advancements we have made and to remain ever vigilant against the allure of quick fixes and unfounded claims. If you want more mysteries like this, the next video explores the strange case of spontaneous human combustion, a phenomenon still debated by scientists today.